Hello, this is Linda Goldman and I'm going to talk to you about the menstrual cycle today. I'm going to start with looking at a picture of the reproductive tract in the female. And we start with the ovaries on the side, the fallopian tubes, the uterus, and the cervix. This here is the vagina down here. So as you recall, the ovary produces eggs. Actually, the eggs grow inside something called a follicle. The follicle releases the egg. The egg travels down the fallopian tube, and what's left over from the follicle becomes something called the corpus luteum. I'm going to show you some pictures of that in a moment. So the corpus luteum remains in the ovary. The egg travels down the fallopian tube looking for a sperm to connect with. Meanwhile, the lining of the uterus, called the endometrium, is thickening. And it is thickened throughout the first half of the menstrual cycle, ready to receive this fertilized egg. If fertilization occurs, progesterone is continued to be maintained, keeping the lining of the uterus nice and thick and stable for this fertilized ovum, now an embryo, to continue to grow into a baby. If fertilization does not occur, progesterone levels drop because the corpus luteum begins to shrivel up and it no longer produces progesterone, causing the lining of the uterus to shed, and that's the menstrual period. When we talk about a menstrual period and you get a history, we want to talk to our patients when was their first day of the last period. The first day of bleeding is considered the first day of the cycle. I have a chart, compliments of Chris73 on Wikimedia Commons. I like this chart a lot. I have the whole chart here, and then I've divided it up in a couple of pieces, and I can show you each individual piece in a little bit. There's several levels. This is the ovary. This is what's going on in the ovary. I'm going to skip over the body temperature for right now. There's the hormone level, what's happening with the hormones that are affected by the menstrual cycle, and then what happens in the endometrium, the lining of the uterus. So the first part of this is the follicle begins to mature, and if you remember the ovary, under the influence of FSH, that's follicle stimulating hormone, which comes from the pituitary gland. The FSH stimulates the follicles which are in the ovary. They start to grow. A whole cohort of them begin to develop at the same time. As these follicles begin to grow, they secrete estrogen. So remember, this is an ovary. So the follicle from the FSH from the pituitary gland in the brain stimulates the ovary to produce stimulates the ovary to mature the follicles, and the maturing follicles produce estrogen, this nice blue line here. So it's the follicles in the ovary under the influence of FSH that produce estrogen. Okay? Now I talked about in the last lecture when we talked about endocrinology, before the pituitary hormones, there's something else. Okay, there's the hypothalamus, and this is true for the reproductive system as well as the thyroid gland and every endocrine system. And the releasing hormone from the hypothalamus is called GnRH, or gonadotropin releasing hormone, GnRH. So it's the GnRH that actually stimulates the FSH. But I'm going to leave the hypothalamus out of it, the conversation, for right now, because it just adds another level of things to remember. So we have the estrogen. Now the estrogen has an effect on the lining of the uterus. It also has an effect on the mucus in the cervix. So estrogen's effect on the lining of the uterus is to thicken it. And as you see, estrogen is here, and estrogen continues to be produced, and it thickens the lining of the uterus. We want a nice thick lining in the uterus because that is where the fertilized egg, should fertilization occur, that's where it's going to set up housekeeping and begin to grow. So let me back up a little bit, because that's not what you see here, is it? You see it starting to thicken here, but over here we see a thick endometrium and then a thin endometrium. So the first day of the menstrual cycle is the first day of bleeding. So the first day of bleeding is going to be the thickest that the endometrium ever is. And that's because it hasn't shed yet. So it starts to shed, and after 3, 4, maybe 7 days, the bleeding has completed, and the uterine lining has thinned down to its normal size, or to its thinner size. Right around that same time, there's enough follicles that are producing enough estrogen. Estradiol is the specific type of estrogen that's produced, which begins to thicken the endometrium. So you have a thickened endometrium, and then you have ovulation happen. Now, I told you that estrogen also affects the cervical mucus, and what it does to the cervical mucus is it makes it very thin and stretchy, and it almost acts like a vacuum. It makes nice, thin, straight strands of mucus inside, and the sperm can literally just get shot straight up to where they need to go on their quest for an egg. So this first half of the cycle is called the follicular phase, if we're referring to the follicles, right? Follicle, follicular, FSH. They all go together. Now, if we're talking about the lining of the uterus, we call it the proliferative phase. It's the same thing. It's the first half of the cycle. It's just what we call it when we're discussing the endometrium, because the thickness of the uterus begins, the uterine lining, the endometrium begins to proliferate. So it's called the proliferative phase down here. I don't have that word on this chart. Okay, here we have ovulation. Ovulation occurs. Now, if you look back up into the ovary, here is really the egg. The egg is little. It's inside the larger follicle. The follicle produces the estrogen, but the egg is right here. When we get ovulation to occur, the follicle bursts open and out pops the little egg. And where does the egg go? It travels down the fallopian tube, and it's going to go over here in the uterus somewhere. Okay, so the egg is gone. It's heading over to the uterus. But in the ovary, we still have something left over, and that is what the follicle used to be. It's now called the Corpus Luteum. It's a Latin word. It literally means body yellow. So it's the yellow body, and it's because it's yellow. And what this does is it produces progesterone. That's the hormone of the second half of the cycle. The hormone of the first half of the menstrual cycle is estrogen. The hormone of the second half of the cycle is progesterone. What progesterone does in the uterine lining is it converts it, and we call it the secretory phase, because it starts secreting carbohydrates and sugars and proteins and all kinds of things that are ready to nourish this growing embryo. So it's called the secretory phase. It's called the luteal phase if we're talking about the ovarian cycle. If we're talking about the endometrial cycle, we call it the secretory phase. So now let's talk about the hormones, of what really goes on with the hormones. We have FSH at the beginning from the pituitary gland, stimulates the follicles to produce estrogen. Estrogen starts to rise. Estrogen gets to a certain level, and it triggers LH to surge. So that's not negative feedback, that's actually a positive feedback system in there. Buried in the negative feedback is positive systems. So we have this surge of LH, and LH surge like that will trigger the ovulation. If you don't have an LH surge, ovulation won't happen. The way we know ovulation happened is we could draw someone's blood. If progesterone is present, that means ovulation happened, because progesterone only is only produced by a corpus luteum, which you only get after ovulation has occurred. So it's a little complicated, but those are the basics of what goes on with the hormone system. As the hormone progesterone begins to rise, more and more substances are secreted, waiting for this nice fertilized egg to arrive, and it wants it to implant. And then there's blood vessels, there's all kinds of nice things to nourish this until the embryo has attached. So after some time, the corpus luteum will begin to degenerate, once it degenerates, the progesterone levels fall. The progesterone levels, if they were maintained, would maintain this nice, thick, secreting endometrium. But as the progesterone levels fall, okay, we go to the next month, boop, we move over here to the next month, the progesterone levels fall and the lining sheds. And we start the whole cycle all over again. So that's what happens in a non-pregnant month. Now, if the woman gets pregnant during this time, ovulation happens. Fertilization actually occurs in the fallopian tube. There's a corpus luteum, and remember, it's producing progesterone, which is maintaining the uterine lining. We want this uterine lining to be maintained. But if the corpus luteum dies, it's not going to be. So what magically happens is the embryo itself begins to produce a substance called HCG. And HCG has a job, and its job will to be maintaining this corpus luteum. It doesn't let the corpus luteum degenerate. It maintains it nice and big so the corpus luteum can continue to produce progesterone, which will continue to maintain this nice secretory endometrium, which is a nice habitable place for the embryo to implant itself. So the embryo itself triggers the corpus luteum to maintain it. The embryo makes the HCG maintains the corpus luteum, and the embryo can continue to grow, and then we have a pregnancy. So this is the ovarian cycle magnified a bit, a little easier to see. Once again, we have the follicle with the egg inside. It's growing under the influence of estrogen. The estrogen it's growing under the influence of FSH. The FSH stimulates the follicle to grow. As it grows, it produces estrogen. The estrogen feeds back to the pituitary gland. It hits a certain area and boom, causes LH to occur in a spike kind of formation. And it only spikes for one day. The spike happens, boom, ovulation occurs, and the egg travels down the fallopian tube over somewhere. Then we have the corpus luteum. It's maintained, or it produces progesterone for a couple of weeks, and then it starts to degenerate. The progesterone will then fall off if a pregnancy does not occur. This just shows a little close-up on the FSH, the follicle stimulating hormone, causing the follicles to grow. It just shows it a little bit blown up and a little larger. It's the same thing we've talked about. Day 1 of the menstrual cycle is when it's first day of bleeding. Ovulation happens around mid-cycle. And not everyone has a 28-day cycle, but if we talk about in terms of 28-day cycle, and we think somewhere around day 14 is when we expect ovulation to occur. Ovulation usually happens 2 weeks before the next menstrual period. So if someone has very regular 28-day cycles, you can figure out or predict approximately when ovulation is going to occur. And sperm can live inside the female reproductive tract for around 5 days, more or less. So if intercourse stops at least 5 days before the expected day of ovulation, and I would add a couple days to that, that can be used as a contraceptive method. It's not the best, but it is a way. It's a calendar method. So remember, the follicular phase refers to the first half of the cycle on the ovaries. The luteal phase is the second half of the cycle in the ovaries with the corpus luteum, follicular follicle. If we're talking about the level of the endometrium, we have the proliferative phase of the endometrium, which is the first half after ovulation under the influence of progesterone. We have the secretory phase, and you'll see both of those written, but secretory and luteal refer to second half. Follicular and proliferative refer to the first half of the cycle. Basal body temperature is a way that contracepting, if you notice, there's a very small rise in the temperature after ovulation. This is only 1 degree. So a basal body thermometer only has about 2 or 3 degrees on the whole thermometer, where a fever thermometer might have 10 degrees on the same scale, on the same size thermometer. The scale is broken down into very tiny, tiny increments. And frankly, a basal body charts will never look like this. They're always up and down and up and down and up and down, but you can kind of sometimes get an idea that they're more up and down over here. They need to be taken before a woman even moves. Wake up in the morning and take either a rectal or a vaginal temperature before moving. Leave the thermometer there 5 to 8 minutes and mark down the temperature. It takes a lot of determination to use this method, and it only tells you after ovulation has already occurred, not when it's going to occur. So you want to know when to stop having sex. Then you also want to know when you can start having sex again. So there's a good chunk of time in the middle of the cycle where sex should not occur if someone is trying to avoid pregnancy. Again, here's the whole chart all together. You can just take a look at that. And remember, the endometrial histology has the proliferative phase, imagine it says that here, and the secretory phase, imagine it says that there. And I talked about the estrogen's effect on the cervical mucus. It makes it very thin and stretchy, and this is a picture. You can see this. This also came from Wikimedia, and you can get this mucus by touching the cervix and bring it out, and it'll stretch a good inch, maybe further. It's very, very slick and slippery and very, very stretchy. And again, it allows the sperm to really swim straight up to the fallopian tubes where it can find an egg to fertilize. Watching the cervical mucus throughout the cycle in combination with the basal body temperature and knowing the calendar method, if a woman knows what her cycles are, if they're regular every month, can all be used together with something called natural family planning as a way to prevent pregnancy. You can go ahead and read these. These are slides that just have words. This came from the document that is posted in your Blackboard course for you. You can go ahead and read it. It's essentially what I've just said. Go ahead and stop the video if you want to continue to read this. This talks more about the follicular phase, which is in the ovarian cycle, what happens to the follicles, and under the influence of FSH, how they will mature. You can read this. And then we talk about the luteal phase, which is having to do with the corpus luteum in the second half of the cycle on the ovaries. You can go ahead and stop your video and read this. The proliferative phase, again, this is the first half of the cycle, but it's what we call the processes that are going on in the endometrium as it begins to thicken. And the secretory phase is the second half of the cycle, the level of the endometrium under the influence of progesterone. This is my image license information from Chris 73. I hope this was helpful for you.